Hey everyone, welcome to What Happened to My Body podcast. This is my first guest, Joy.
Hi.
We have had some technical difficulties today, and now we're recording. She is having a baby in 2 days. She has a lot to fill us in on before she goes into labor. So, Joy, if you want to start.
So I can remember as a child a lot of the problems, but back then the medical field was a lot different than it is now, which is crazy because I'm really not old. I'm only 23, but it's changed so much. My first diagnosis was celiac disease, and that started in 2019, but my entire childhood, everyone was like, she's anorexic, she looks too small, does she even eat? I can remember as far back as like kindergarten, and I'd go to lunch and I'd come home and get in trouble because I ate everything out of the sandwich but didn't eat the bread. From such a young age, my brain didn't correlate with that. The reason I didn't like it is because it tore up my stomach. Anytime flu season, strep, everything came around, I was always sick. It wasn't until I was 17, my brother ended up in the hospital. It comes back and he has celiac disease. And my mom's telling me, and I'm like, hey mom, I think I have this. My mom starts thinking about it and she's like, that makes so much sense. I didn't weigh 100 pounds until I was a sophomore in high school. Okay. And I was 5'6". I didn't really understand. I ate a lot. My entire childhood, I was like, I just don't have solid poop. This is the big misconception with celiac, because people are like, oh, it's like you're allergic to gluten. No, it's my white blood cells rapidly multiply and eat my small intestines. Like it pulls apart my small intestines looking for the gluten. Okay. At this point, the gluten's already gone. My body already pushed it out. But you're in a phase of autoimmune for upwards to 6 to 8 months for your intestines to fully heal. I can pass that down because I have the active gene. Celiac is really weird when it comes to DNA. Both my parents have the gene. Neither of them have celiac disease. I just so happen to have the key to their two doors. Celiac disease activates when your body goes under a tremendous amount of stress. A trauma, childhood trauma can unlock autoimmune diseases, a major shock to your immune system. We figured out that dysautonomia and celiac disease can actually both be activated in the womb if the mother goes under a tremendous amount of stress, anxiety, trauma. During that time frame, she has a 90% chance of getting the gene, but it's like between 20 to 50% chance that it could actually unlock and activate. Him not having it as an active gene dilutes my active gene. As I was a child, I was riding my bike and someone's tree had fallen over on the sidewalk. It was like a big branch. I hit the tree and I flew off my bike and the handle hit my kneecap and dislocated my kneecap completely underneath my leg. Fast forward to when I'm 13, I'm trying out for the track team and my knee just floats. It just dislocates. My mom finally finds out. We go to see a orthopedic surgeon. And her growth plates are too big. Her ligaments and tendons are stretched. I can't perform surgery because her growth plates are too big. She doesn't look like she'll be done growing until she's 18. So I don't want to touch them. It's too risky. Instead, I went to physical therapy for 3 years, had to wear a brace. In junior high, I made fun of because everyone's like, oh, she's the knee brace girl. She's always sick. That played a big role on my mental health and friendship growing up. I get to high school, I'm in marching band. I did so much physical therapy that I don't really have to wear my brace anymore. I also grew a lot, so that helped. In high school, I started having hip problems, which is really wild for a 16-year-old to be having hip problems. We ended up going in to see a chiropractor, and your right leg is a half an inch shorter than your left leg. My hips are just like this. I had to wear an insert in my shoe for a long time and come back monthly for alignments for him to pop my hip out of socket to make it line back up. We did that for a long time, and it turned out that I had a small case of scoliosis coming out of the base of my spine because of that sling. Okay. So there's just a basic blood test that you can do for celiac. Super simple. They run it and my numbers come back through the roof. I know I just need to go strictly gluten-free. So I immediately do that. And it's been 6-8 months where I'm strictly gluten-free. Granted, strictly gluten-free is very difficult to do, especially when you grew up not having to eat that way. Little things that you don't think about, like soy sauce, teriyaki sauce. Oh. You have to do so much research. We should have done the endoscopy immediately, but we didn't. And I went the gluten-free route, and then I kept having problems. The stomach cramping didn't go away. The nausea and stuff like that had gone away. I was starting to have TMI, but I guess normal stools, like I wasn't having diarrhea all the time. One of the biggest red flags, and you can look for it in your babies too, is bile. Celiac stools have the most potent stink. It smells like something's dead. You might have tarry texture. I started to have the normal stools, but the cramping wasn't going away, and I was still just sick. I was really lethargic, overly tired. As parents, you're like, oh they're 16. They're probably staying up super late. They're not sleeping the way they should. They're growing. They're gonna be tired. No, I'm talking like I could not get out of bed. The body aches. I'm just depressed. I struggled with suicide when I was younger. It's very difficult, especially when you're not being listened to and everyone's just, they're anorexic. They need to eat more. So we get sent to a Texas children's doctor. This is the doctor that could have diagnosed me when I was 18 and didn't, and I ended up not being diagnosed till I was 23. We go see him and I'm like, hey, these are all my problems. Are you eating gluten-free? And I was like, yes, sir, I am. And celiac is a very easy test to tell if you're actually eating gluten-free or not. It's the same blood test that you get diagnosed with. When you're actually gluten-free, that marker is not there anymore. You look normal. Your blood test is going to say that you don't have celiac disease. And that means you're in remission. So he takes my blood test and it shows slight elevation, but it wasn't enough to say, oh, you have celiac. Thankfully, like I had my other blood work, it showed that I was on the track of being gluten-free. So he's like, we need to do the endoscopy, rule out IBS, Crohn's, all these things. When you have one autoimmune disease, you normally have 3 or 4 other that kind of come with it. Other thing is I had a rash. It was covering my left hand. It matched the curve right here of my hand. My skin was literally like as if I poured acid on it. It looked disintegrating. It's really bad. That's called dermatitis hepatiformis. It's a form of celiac disease that outwardly shows. And you only get that in like severe cases. For me, I can't touch gluten. Touching it sends my body into a flare physically. That was something that I always had as a child. I had it on my feet, I had it on my hands. We tried all the different things. It would go away, then would come back, and it was like, oh, there, it's just seasonal eczema. It got to a point when I started healing my intestines that it wouldn't go away. And it was getting worse, which was really confusing because I was like, I'm gluten-free, why is it getting worse? So we get the endoscopy done, and he tells me, so I need you to eat gluten. I've been avoiding it for the past 6 months. What do you mean you need me to eat it? Because I'm already going in, I might as well just get the official confirmation that you have celiac. We have the blood work, let's get the double confirmation. In reality, that should have never happened. I should have tested the way that it was because I was having problems while being gluten-free. I get my results back and it's like active gastritis, active duodenitis, celiac disease present, my villi, which is like the little fingers that grab your nutrients from your food when it goes through the small intestines. Mine are like, basically celiac eats those and flattens out your small intestines. That's where the malnourishment comes from. So my villi are all destroyed because my immune system ate them, looking for the gluten. That's where the malnutrition comes from. I will say I had fun with eating, but I was getting like Starbucks cheese danishes. I was enjoying it, but I'm like forcing myself to do it and throwing up. My brain now correlates, I cannot eat this. So it's very difficult to do that. I had to resort to just simply eating a piece of whole wheat bread on an empty stomach first thing in the morning, because that was the only way I could get it down. We get the results back and I have celiac. Just eat gluten-free. I was like, but we knew that. And the testing said that I needed further testing. We didn't figure this out until we look at the results presently. Within the last year, I'm pulling up on my charts and stuff and like trying to figure out what's going on. And it says patient shows signs of possible Crohn's disease, IBD, IBS. It showed signs of all the different things that it could have been. We didn't know any better. We're gonna trust the people that are the specialists. And I was like, okay, I just got gaslit. So I go about life. I'm in this relationship. It was not a healthy relationship. It sounds stupid. I'm being bullied for having this autoimmune disease. Fights happening because I have to eat a different type of cookie dough than they can. In the beginning, I gave that grace because I was like, okay, this person just got like news that also not only changed my life for the rest of my life, but also changed theirs if we are to get married in the future. Because it's like, this affects our children, this affects everything. I have to live in a gluten-free home. I can't have gluten in my house.
I look at those past times. I'm so glad I did that experience younger and I didn't marry that person.
Fast forward a full year. 2020, I get the endoscopy done.
What's an endoscopy?
Where they go down, they scope your throat into your small intestines. They get to the entrance of your stomach, but they can't go past it. 2021, I actually ended up having a really bad episode of lockjaw. My jaw just locked shut. I always had TMJ. I'd break fillings and stuff like that. I start having a lockjaw episode, and I get a retainer, and then I crack the retainer. I end up at a orthomaxillofacial surgeon and end up having to have jaw surgery. It's dime-sized incisions. He ends up pulling out a dollar-sized coin of inflammation out of my joint. And then on my left side, he pulled out, I think it was like a nickel-size coin of inflammation. When it came to coming off of the anesthesia, next thing I know, all the lights in the, like my little curtain spot turned red, and the monitor starts screaming, and they're like, grab a crash cart. And I look over, and my O2 is like at 30%, and my heart rate was at like 20 beats per minute. The next thing I know, I blacked out. Then I woke up, and I was awake for a few minutes, and they're like, she's good, she's stabilized, pull me off of the oxygen, and it happens again. And that happened 3 or 4 times. I was in recovery for a good 3 hours when I should have only been in there for 30 minutes. That experience happens. We never figured out really what happened. They're like, you just have bradycardia. At the time, it was like I just had an abnormally slow heart rate. It was weird because I didn't have that problem prior to the surgery or that we knew about. So I get the Apple Watch, and my average walking, like lifting, working out was like 80 beats per minute, which is like low, but that was just like normal for me. They called me that I had a runner's heart. So I had my surgery in December of 2021. 2022, beginning of the year, I'm like, this is my year. I have my celiac under control. I was so excited. I was like in the gym. I was getting my life under control. I'm getting my heart rate and stuff under control. I was starting to gain some weight. I was like steady staying at 100 pounds when before I was dropping to 70, to 80, to 90. Now I'm like chugging protein drinks, eating like crazy, trying to figure out how to manage this lifestyle. And going to the gym, I hit a max on the Smith machine. When I popped back up, I forgot about my form. And I dislocated my knee for the first time in 6 years. So I laid down, stretched it out, iced it, KT tape. I knew how to treat it. But the next day, it was like really weirdly swollen. I go to my chiropractor. He looks at it, he goes, yeah, I'm gonna have to send you to a surgeon. My kneecap was sitting on my femur. It wasn't even in a socket. My kneecap had created a socket of its own. At some point during time of me growing, it dislocated and never put itself back in its socket. So as I grew, my thigh muscle just continued to pull it up higher and higher. They had to cut was my tibia in half, which is your shin. Not going to be able to walk for 3 to 4 months. It's like a huge recovery. I can tell you October 23rd, 2022 is when I had the surgery.
Okay.
Traumatic. It was so bad. I took 3 to 4 months of not being able to walk and turned it into 2. I was walking before Christmas in December. Completely brace-free. I have 0 muscle on my right leg. You could see just my bone. I pushed through and I kept working out and I got my life back. I ended up seeing a psychiatrist and getting diagnosed with major depressive disorder, ADHD, and severe anxiety disorder. She was like, your fight or flight is kicked in and won't turn off, which is preventing your dopamine levels from rising. I start the medication and I'm on Wellbutrin. I start working out again, and my stamina's not there. The way Wellbutrin works is I'm having dips, and I'm not supposed to be having those dips. So now we're up to max dose. I felt the best I had ever felt. It was around Thanksgiving, 2023. I was serving, and I was walking a tray of bar drinks back to the table, and my coworker looks at me, and all of a sudden, my hand just like starts shaking, like seizure level shaking. I dropped my tray all over the floor. I went pale white as a ghost, was instantly like beating down in sweat. I felt like I was having a heart attack. And I checked my Apple Watch and my heart's like 160, 170 beats per minute. I ended up in the bathroom, like on the floor for 30 minutes. My heart rate was not coming down. This isn't a panic attack. It passes. And I tell my psych about it and she goes, I need you to go get a cardiac eval. We're going to taper down the drug. Let's get you to a cardiac. I have to do a heart monitor. So I wear this heart monitor for 2 weeks. It came back that you have PVCs. Not traumatic. He goes, but it's very important that if it gets worse, I need you to immediately come back to me. That's in January of 2024. I get a stomach bug in about June of 2024, and it puts me in the ER. I had it for 2 or 3 days, and I hadn't been able to keep fluids or anything down. Turns out my potassium was like dangerously low. They had to sedate me when they rehydrated me because my body started to tremor from being so dehydrated. We chalk it up to celiac disease. After that, it's like weird things happen. Oh, now my blood sugar's acting weird. Celiac. My body went through a traumatic situation in August. A week exactly after that had happened, I had a weird rash show up. It looked like just a normal hive rash. and it didn't itch. And it was only on my torso, like sides of my boob, on my arm, like in my armpits. It would go to spread into my back, and then it wouldn't touch my back. So I go to the doctor, they put me on a steroid pack, and the steroid pack calms it down, and then it came back with vengeance. So we do a different steroid, it calms it down, and this time it's come back full force. At this point, I'm having blood pressure problems, heart palpitations, all these really weird symptoms with this weird rash. I spend the whole day in the ER, I'm like severely dehydrated. And I'm like, what the heck? I drink water like nobody's business. I chug it like over a gallon a day. I'm very hydrated. I downed 2 bags of fluid before they sent me home and had to do a round of IV steroids. The rash finally clears up. Still no answers. Now I'm having blood sugar problems. Pale stool, abdominal cramps. It sounds like I'm in a celiac flare. So I call Texas Children's and get the referral to Baylor, and I start seeing a GI in Baylor. It took 3 months to get in with him. I'm just tracking symptoms of my heart rate being at a pulse 80, 90 to 145 beats per minute within seconds. And it dropping from that back down to 70, like out of nowhere. So it's like spikes drops, and my blood pressures are like 140 over 90. I'm a healthy 22-year-old at the time. There's absolutely no reason I should be having high blood pressure. There's no reason I should be having hypertension. There's no reason I should be having blood sugar problems. I go see this doctor. I have a binder full of every blood test that I had ever had done, color-coded, organized, CBCs, everything. And I'm like, okay, there's a pattern here. I promise you I'm not crazy. I'm not a hypochondriac. I swear. I have celiac disease. I was undiagnosed for 18 years. So I hand him the binder. He looks at it for a couple seconds and then hands me it back. And he goes, all right, tell me more about your symptoms. And he's, I believe you. I'm sorry. The medical system has failed you. There's no reason that you should be at this point. You're 22. So we're going to run all these tests. We're going to run these panels. Let's test your celiac levels. And we're going to do an endoscopy and a colonoscopy. Let's rule out IBD, IBS, Crohn's. That's the only way we're going to rule out these things. The test comes back and it shows that I'm actually in 100% remission of celiac disease. Meaning, for the last 4 years that I've been going through this process, and they've all been like, oh, it's celiac, like she must not be gluten-free. I actually was, because it takes 6 to 8 months after every contamination for your levels to completely go down and for your intestines to heal. We get the endoscopy and the colonoscopy done. Everything comes back normal, which is very defeating. He's like, you have IBS. At this point, I'm crying and I'm frustrated. It doesn't make sense. Why am I almost passing out? Why is my heart rate being this way? So he looks at me and he goes, have you ever heard of dysautonomia? Believe it or not, I have. Like my friend growing up, she had POTS. He said, let's run a hormone panel. Let's check all of your hormones, your fertility hormones. Let's run everything. And it was like $16,000 worth of tests. As I'm waiting for the test results to come back, I'm standing in the kitchen. And my heart rate jumped. I was having palpitations really bad. My chest was really tight. I felt really sick. I was really dizzy, really nauseous. I'm talking to my sister, who's an RN. She goes, I need you to go to the ER. So I go, they hook me up to a cardiac monitor. I end up getting sent out. I call my heart doctor, and they get me in literally the next day. So I go to my cardiologist, and one of the first questions he asks me is, are you pregnant? And he goes, let me see your EKG. He sees my EKG. At this point, my sister and I have done all of our research on all the different forms of dysautonomia, because there's a lot. It's not just POTS. Dysautonomia is a huge blanket term for basically your autonomic nervous system just doesn't know how to function. Everything that your body does automatically without your brain having to tell it to do it is autonomic. So sweating, hydration, digestion, your hunger, body weight, your joints, ligaments, tendons. Ehlers-Danlos syndrome is a form of dysautonomia, one of the autoimmune versions. I had gotten tested for rheumatoid arthritis and Ehlers-Danlos syndrome back in 2020 when they were like looking to see if I had the trifecta. And I did not have all of the markers for Ehlers-Danlos syndrome, but I did have a few of them. One of the like weird things is the hypermobility and the way my hands bend. They were like, you have hypermobility, hyperelasticity in your ligaments and joints. Again, they're like, celiac. Was not celiac. I also had the RH factor. At this point, I've been with Joey for a year and a half. I go into this appointment and my mom's with me and she's asking all these questions. He goes, it shows more PVCs than you'd had before. And he goes, it's not alarming. There's still nothing we can do about it. It's just going to be uncomfortable. So when he's taking my pulse here, he's taking my pulse and my wrist at the same time. And then he does my wrist and my feet. And apparently my pulse was different in every single spot. So you have postural orthostatic tachycardia syndrome, which is POTS. Postural orthostatic tachycardia syndrome, meaning that your blood pressure and your heart rate jump. The qualification is like 30 beats from going from sitting to standing. You'll have a 30 beat jump within a couple seconds to a couple minutes. It was continuously getting worse because we have vasovagal syncope as well, which is the opposite of POTS, except there's no trigger. So basically my heart rate and my blood pressure will just drop. Nothing promotes it. There's no trigger to it. It just drops. A lot of people have a response to like needles when they get a shot or their blood taken, they'll pass out. It has to do with your vasovagal nerve. Then your heart rate's just inappropriately high. So IST. Inappropriate sinus tachycardia. My heart rate is just inappropriately high all the time. Right now my resting is at 93. I use an app called Tachymon to track my heart rate. But like for example, at 4:02, which was just a few minutes ago, my heart rate went from 88 to 67 beats per minute. Just like randomly. I haven't moved. Earlier I was sitting and had to jump from 81 to 112 beats per minute. My lowest today has been 63 and my highest has been 128. What's happened before I found out I was pregnant, which is when we started trying to get the diagnosis in August. So right now you need to have a minimum of 6 grams of sodium a day, and water dehydrates you. With POTS, IST, and BVS, they all work against each other. So my IST triggers my POTS, but then my IST also triggers my vasovagal syncope. During all of this, I also have orthostatic intolerance. So my blood pressure doesn't regulate either. My blood pressure is all over the place. So you just like basically like drink electrolyte drinks all the time. Yeah. My body doesn't know the difference of going grocery shopping or running up a flight of stairs, especially recently. So there is treatment. There is treatment to manage dysautonomia. So he's, let's put you on metoprolol. Small dose. I don't want to jump to meds. I want to try and manage it without medication first. Basically, my body's been this way since I was born, is his theory with my dysautonomia. But then we had the question of what came first, the chicken or the egg. What came first, celiac or dysautonomia? Because celiac can activate dysautonomia, but dysautonomia can activate celiac disease. The problem is your blood isn't coming back to your head. It's not going back up. So we're having the vasovagal episodes because there's not enough blood coming to your heart, which then my heart compensates by pumping too fast and then my blood pressure. And it made sense why all of a sudden my tolerance for working out was just gone because I stopped. For the first time in my life, I wasn't active in that way. When I was in high school, I was in marching band or I was raising livestock. Constantly using my leg muscles, that my blood was constantly always just pumping faster. Mm-hmm. I always had problems with my heart rate. We can tell back in 2020, I had a hard time coming off of anesthesia. And I had a weird episode where my blood pressure, my heart rate, and my O2 levels, everything that's autonomic, didn't function right. So that's a moment where that was definitely a dysautonomia flare. Right? Whatever they had given me countered with my dysautonomia and sent me into a vasovagal episode of my heart rate and my blood pressure just plummeting. And the reason it kept just coming back up and then going back down, coming back up, is because that's what POTS does. I was doing liquid IVs and they were working and wasn't drinking any water. Liquid IVs only have up to about 5 milligrams and I needed 6 grams. So I'm going to get 4 grams of sodium in through my fluids and then I'll get the rest in through my diet. It was just a lot with the liquid IVs, so I found a new brand and it's called VenturePal. With a gram of sodium per packet. I only had to drink 6 of those a day, which sounds easy, but it's extremely salty. And it has magnesium, potassium, all those things in it. So I get better. And then all of a sudden, I take like a big turn for the worse. I was 1 day late, so I took a test. And it instantly was positive. I was completely flabbergasted. Instantly, I scheduled an appointment with my GI doctor because celiac can affect fertility. So I'm like, what are things that I need to look out for? We also were making sure my numbers were doubling the way that they were supposed to. My numbers were like through the roof high of my HCG numbers. They were like, this is either twins or you're further along than what we think. Then I go see my cardiac, like right after that. He walks in the room and he goes, Joy, I asked you 14 days ago
if you're pregnant.
And you told me that you weren't. I was. Surprised. You're surprised. I'm surprised. We're all surprised here. Mm-hmm. So this is the new thing. Now I have to be at 9 grams of sodium a day. Instead of me having high blood pressure and high heart rate, now I'm having low blood pressure and low heart rate. So we did the little flip-flop. Now my body's like trying to make more blood. You have the whole doubling of your blood volume and all those things that happen with pregnancy. So same concept is I have to have more sodium because I'm pumping more blood. And my body's now working in overdrive to create a whole other life. So that makes a huge difference. And so we're not going to do metoprolol. At this point, it's like compression socks 24/7. I couldn't go without them. Right. I find out that I was only 5 weeks I get in with this OB. They diagnosed me as high risk. At first, I'm loving this OB. Then we get to a point where my symptoms are getting worse and I'm almost passing out, and my blood pressure, heart rate is so bad I could barely stand, I could barely walk, I couldn't do anything. Back to the B12 deficiency thing that I had mentioned earlier, I actually have a gene called, people call it the mother effer gene. You cannot have folic acid. So the antidepressant that I was on, turns out it actually is used to treat POTS. So the reason I had such that bad episode at one time was because we went to max dose of Wellbutrin, and my body responded to that with a POTS flare. So many things click. We don't know 100% if this correlates. When I was like a toddler, I had blue face syndrome, where I would hold my breath till I passed out. My mom's like, she's not like intentionally holding her breath. She's just crying and passes out. That's a sign of POTS in like children. And dysautonomia. It's one of those most random things. I'm seeing this doctor and we get to 14 weeks. I can't take folic acid, so I have to take the methylated form of B12. I go to my doctor, I'm like, hey, I think I have anemia. I'm treating my POTS and I'm treating my dysautonomia and it's not working. She's, oh, we'll test for anemia at 28 weeks. Can we test now? She's, we can test if you absolutely think that it's necessary. With my history of doctors, I just kind of shut down. I was like, whatever. Baby's fine. She's growing. And I just got really sick to the point where I was not getting out of bed. It was worrying Joey. Joey didn't want me driving anywhere because my flares were so bad and so out of nowhere. Beginning of the first trimester, I was low blood pressure. Now we're having high blood pressure. Then we have low drop again. I'm talking 80/40 as my blood pressure, really low. And my heart rate's 130. And I'm telling her these things and she's like, you're fine. At this point of high blood pressure, causing me to vomit to the point where I'm throwing up bile. I'm losing all of those fluids. And now I'm starting over from an empty fluid station, empty salt. I'm like, I need IV treatment. I was going to like the little ER and just going in, and sure enough, I'm dehydrated every time I'm going in. I'm telling her this and she's like, you're doing the right things. And I'm like, there has to be a better solution here. This pregnancy should not have to be this hard. She just wasn't listening to me. I take it into my own hands. I go and get blood work done at like 18 weeks. It comes back that I was severely anemic. My cardio goes, I want to do a heart monitor for the next 2 weeks to see what happens. We're coming to the end of the second trimester. My heart is working extremely hard. My resting heart rate was like 110, 120. In pregnancy, your heart rate naturally already increases, but not to 120 as you're resting and 160 as you're doing the dish. It's very uncomfortable. I'm making the big decision of changing OBs at 20 weeks when a lot of OBs will take you. I was like, great, I'm gonna be turned away. I'm gonna be dismissed, especially with my conditions. So I posted on a whim in this POTS pregnancy group that I was in on Facebook. I was like, anyone in the Houston area have an OB recommendation? I put down my situation and I had one recommendation come through. She was at the Texas Women's Hospital. She's a maternal fetal medicine, but she's not an OBGYN. So I start looking at OB-GYNs in her office and I find this one. She actually is an OBGYN, maternal fetal medicine, cardio specialist. I have open insurance, but she had to have a referral. I get my PCP to do it. I am calling like daily to this OB and I'm like, how long till I hear back? They're like, okay, she's actually moving clinics. She's leaving on Friday. I was like, what does this mean for my referral? Do I have to get a new referral and send it to the new spot? And they're like, basically what's gonna happen is your referral will get processed here this week, but you won't get a call until they're at the new location. So 2 weeks passes, we're at 24 weeks, and I still haven't heard anything. But they don't call me. At this point, I'm hitting 27 weeks, and I have to get this gestational diabetes test done. Finally, I get a call from one of the PAs. She goes, I am so sorry. This has been a nightmare of a change. She gets me in literally like that upcoming Monday. I go in, get an ultrasound done. Baby's looking great. I meet with the doctor. I'm 28 weeks. I had no answers on what labor delivery looked like for me. No one has helped me. Nothing. If I can't even walk up a flight of stairs, how am I supposed to push out a baby without having heart attack level heart rate? Am I supposed to have a C-section? Is vaginal okay? And I had no answers. So I tell her all these things and she's, okay, do you have your blood pressure cuff? Make sure that it's reading accurate. At the time of the anemia, I was having purple feet because my blood was sitting too long in my feet and my blood was stagnant, which is why I can't go without compression socks. She asks the important question of, what is your birth plan? I stressed her, I don't want a C-section. She goes, okay, you want an epidural? At first, I did not want an epidural, but I knew at this point it was unrealistic for me because my blood pressure would get too high. She begins to express the game plan. We'll induce. Let's do everything we can to get to 38 weeks, 39 weeks. From the moment that you get there, you'll start fluids. And then you will be on fluids until post-delivery. We get all that information and she's like, let's try and get you home health for fluids. Granted, it did take, we're 38, 34 weeks to get fluid. I just got them finally in the last month. It was like hell between insurance and the hospital. I have to go into the hospital to get infusions, but it's okay. It's only once a week and I go get one back. So it's not like an insane amount, but that one pack really does a big difference. The other thing, she was like, we're going to do an at-home glucose test. I'm going to send you out a prescription for a glucose monitor, and you're going to just prick yourself 4 times a day at home for 2 weeks. Came back 2 weeks later, my vitals were still very all over the place. Not really much we can do. She's like advocating to the hospital and fighting to get an earlier induction. We go into our 36-week appointment, and we find out that baby has low amniotic fluid, which was a scary thing to hear because low amniotic fluid is not a good thing. We're already at weekly appointments. She's seeing you next week on Monday. If levels don't increase by Monday, I have to induce you on Monday. Nothing made sense. I'm getting IV treatments. Why would my fluids be low when I'm drinking this many fluids? My sister and I had a big question about, dysautonomia. Amniotic fluid is something that happens automatically. We had other red flags that happened. We thought my water broke. At 28 weeks, I started leaking fluid. I went through a panty liner, through my underwear, through my pants within 4 hours. It had no smell, no color, no texture, and I was having contractions as well. And we called the OB on call, and she's like, you need to get to the hospital ASAP. It turns out I had BV, which didn't make sense because I had no signs and symptoms of bacterial vaginosis. Started an antibiotic. I come back again because the weird fluid happens. I have a yeast infection. So this is another week of treatment. I treat this, and the same thing starts happening again. We go back. I'm like 30 weeks at this point, and we're like, what the heck is going on? They're like, hey, I hate to break it to you, but you have BV again. We finally clear it all, and we're good. And then we get the low amniotic fluid. She goes, we have to do fetal movements every day. If you get 9 in 2 hours, one less than 10, you go in. This is all on a Monday. Tuesday, I wake up that morning and I had a gut instinct that something was wrong. Her movements were really weird. They were really low. They were really slow. Something just wasn't right. We go in, we hook her up to the monitor, and she's having D-cells. Every time she's moving, her heart rate's dropping. Thankfully, my OB was the OB on call. So England is ordering a special ultrasound. She goes, your test showed that you were at a 6 for your amniotic fluid. So you're normal low. She passed all of her movements in the ultrasound, her breathing and her like swallowing. And my fluid levels actually came back as a 6.5. I went up a half a centimeter from the day before. We end up finally getting to go home. We make it to Monday, 37 weeks. I felt so relieved, but I was so anxious because I had packed the car full of the stuff just in case. We go in and we get the ultrasound done, and baby's not moving. And Joey got stuck at work, so he couldn't come. The ultrasound texted him, come on, baby, come on. She's not practicing her breathing, and she's not moving. You could tell the ultrasound tech was like stressing. She goes, oh, here's baby's head. Then Alice starts breathing. Thank God. We get the results back. My amniotic fluid went from a 6.5 Tuesday, a week later, to a 10.5. Oh. The only explanation I have on that is my brain just all being in agreement that like it was going to work out. And this is what's happening Wednesday. We're doing this. My vitals have been very bad. All it's done is prove more and more that it's not safe for me to go past 38 weeks because of my flares. The biggest concern is the bigger my belly gets and the bigger she gets, the more it compresses on my vagal nerve and my main vessels that get the blood from my feet to my heart. I will say I don't really have any weird feelings towards it. Postpartum's gonna be scary. That's a whole other battlefield.
I have a feeling we have undiagnosed dysautonomia walking around.
Same. Yeah. I have some friends that I'm like,
they should listen to this.
It's definitely a journey, and it's definitely a hard one.
I can't wait to see pictures of the baby. I'm really excited for you. No matter what, it's going to be a great experience.
Oh, yeah.
You're gonna be an awesome mom.
Thank you.
I was really happy to have you on today, Joy. Thank you.
Thank you.
I love learning new things, and I feel like I learned a lot today. All right, we're going to end it. I hope you have a good day. I don't really know who our next guest is going to be, but we'll have one. See y'all soon.